Good morning, good afternoon, good evening, everyone, and welcome to this TechNet 21 webinar series on deploying an electronic LMIS, making the right choice. I'm delighted to welcome our guests for this session today, the topic of which is introducing Logistimo LMIS software and services. Today we have with us 4 panelists, actually 3, we're waiting for the 4th one. So Joseph or Joe Mtenge, sorry about that, Joseph Mtenge, EHIN ICT Officer, UNDP Malawi, Niraj Takare, who's Director of Research at Logistimo, and Anup Akihal, Chief Executive Officer at Logistimo. Austin Omyunu, EHIN Project Coordinator at UNDP Malawi, will join us in a few minutes. Logistimo will start with an introduction of their tool during the first 15 minutes or so. Then Austin and Joe will present the Malawi case study. We'll finish this session with questions and answers. You can ask your questions during the presentation in the Q&A box or in the chat box. They will be answered by the panelists after the presentation. As usual, this session is recorded, and we'll share the links to the video as well as the slides by emails and on the TechNet 21 website. Finally, if you're interested in joining a community of practice immunization supply chain professionals, you're welcome to join our new Telegram group on immunization supply chain, where we'll share information on this webinar series and more. And I'll write the link in the chat box for your convenience in a minute. Anup, the floor is yours. And you're on.
Thank you, Alex. So we can move the slides. One more. Okay, so we are sharing about our logistics management information system product today. Slide. You can advance the slide. Thank you. It's offered in these 7 languages that you see here, and it takes an additional 2 weeks to set up another language, any additional language. Next slide, please. What makes our system special, I think, is its ability to gather data reliably. This is partly due to a seamless online-offline experience that works under various network contexts, but keeps a consistent user experience. Next slide. Our 4 customers are in Africa, 4 EPI customers in Senegal, Angola, Zambia, and Malawi. Next slide. So going over the functionality, so forecasting is available in our system. We give you various different ways of calculating forecasts, but it goes further than that. We also provide some optimization that, if you go to the next slide, after forecasting, it gives you the ability to predictively manage inventory, where it predicts the inventory position into the future based on inbound shipments, based on consumption rates, and so on. Next slide. And it goes further than that, which is that the system, if configured, will recommend a replenishment quantity at the time of order, and the user can overwrite that recommended quantity by giving a reason code. Next slide. We do have batch level visibility, both on mobile and on web. When different batches or lot numbers are presented, they're presented in a way that is helpful to the user. Select the most opportunistic batch for picking, for example. So it'll be ordered by first expiry, first out, for example. Next slide. And of course, we have a very robust order management system between various levels of the supply chain. It includes messages from the various users. You can split shipments. You can back order. You can add transportation information. You can include approvals also via mobile by managers. Next slide, please. We have a real-time inventory management system, as you can see here in the menu options on the left. Next slide, please. And with that real-time information, we're able to present information in a way that is easy to consume by users. That's a picture of a bulletin board, which we try to provoke conversations about the supply chain conditions. Next slide. And yes, there are wastage reason codes in the system as well. You can configure whatever the reason codes that are applicable to your environment are. Next slide. We do have a cold chain asset management module with remote temperature monitoring capabilities through an API. In this system, you can see the temperature between the typical 2 and 8 degrees. If the device has the capability, you can also see power, and you can see the geolocation that you can stamp. You can take up to 5 sensors. You're able to configure and push configurations wirelessly through the web console to devices if they're set up that way. And of course, there'll be some maps and other analytics around temperature and asset management. Next slide, please. And then further than that, we distribute that information about asset management, whether it be good or bad, inventory management, order management, and the entire gamut of logistics management information functions. And we try to disseminate the information in a way that is socially engaging, in a way that there can be proper recognition for good management behaviors so that we can reinforce those behaviors. Next slide. Yes, we have analytics on the system, various types of a big data analytics platform. Here you can see vaccines being compared for availability. Next slide. And also those analytics can be set up to automatically send to various users or role players, and you have a great degree of control over how they receive that information. Next slide, please. Yes, this system is feasible to use at the last mile and at every echelon up to the national level. So typically we see this in a multi-echelon value chain. And this is just a visualization tool that we use to validate supply chain structure. Next slide. And of course, because there are mobile devices in the hands of users, we are able to collect geostamps and timestamps and get a very fine look at operations, how they're happening on the ground. And this can be helpful during a campaign, for example. Next slide. We try to make things easier. We have a particular module that allows for taking a photo of paper forms. So the ubiquitous paper LMIS forms, you don't necessarily need to change training. You can just take a photo of that form, and we have a pretty reliable way of bringing in those data to the cloud with an opportunity to validate the numbers as they're going up. Next slide, please. Yes, we do have barcode scanning. You can see on the left on the screen, there's a barcode icon. By touching that, it engages the camera. And then, of course, it automatically will scan 1D, 2D barcodes, depending on the specification. Next slide. To address the questions around integrations, DHIS to ERP and other integrations are all possible. We typically offer assistance in defining the integration case. We share APIs. We provide access keys and a test environment. We work through local implementation partners. So we don't have a large team on the ground, but we work with various local implementation partners. It typically takes about 2 weeks to make an appropriate knowledge transfer for deployment. However, trainings and the duration of trainings vary significantly depending on the use case. And so we've seen that range from as low as a single hour for very simple cases, all the way up to a 2-day course, for national level users who have more responsibilities in more cases. And of course, we tend to hold hands, if you will, with the client after deployment to make sure that things are stable before flying alone. Our pricing is transparent. You can visit our website with the URL provided here, and there's a calculator that you can simulate various scenarios and understand the cost situation in each. I'll also note that there's a 40% discount currently on annual reservations on top of the, where I say 40% less than what pricing you see on the website. Next slide, please. To those people who are interested in understanding about the design of the user interface and the service design, our CTO has published this paper, which I encourage anyone to go check out on ACM Compass. And this gives you a pretty deep insight into how and why we've designed the service the way it is, and probably some inkling into why it's been working. Next slide. So it's my pleasure to begin introducing the team in Malawi. We're very proud of this project. It's not just an EPI project. They've done something a bit more ambitious, which is managing several verticals under the same system. So currently they have nearly 1,500 entities that are live all the way to the last mile. They're passing millions of transactions on an annual basis. And they're managing more than 2,500 commodities across various global health verticals. Across these verticals, they have achieved already greater than 93% stock availability in their country. And they're also using the system for managing the COVID vaccine distribution. They've tracked more than 14 million doses so far. They have those bulletin boards used at the national ministry level. And they've already rolled out to all the EPI stores, and they're beginning to roll out to all the non-EPI stores as well right now. So it's a very exciting project. And if you go to the next slide, I'll just introduce the gentleman who will be talking about their experience in Malawi. I don't know if Austin is on the call yet, but Austin Omiunu is the Electronic Health Information Network, that's EHIN, project coordinator with UNDP Malawi, and Joseph Mtenje, who is the ICT officer for the Electronic Health Information Network, who's also with UNDP Malawi. And so it's my pleasure, next slide, to hand it over to you guys.
Thank you so much, Anup. Hello, everyone. As Anup has said, my name is Joseph Mtenje. We're supposed to have Austin, but he'll be joining us in a moment. I'm sure he'll be there for the Q&A at the end. Next slide, please. Okay, so like Anup has said, Logistimo software is being used in Malawi, where we have named it as EHIN, that's Electronic Health Information Network. So in Malawi, we are using it as a tool to manage our health supply chain. That's all the way from the central level to the last mile. So we've got the mobile app, and as well as the web application, as Anup has said. And for the mobile app, it's being used at the last mile. So the last mile, we've got, these are the service delivery points where patients are being served from, or clients. And it's also aimed at improving transparency, accountability while managing health commodities. So in Malawi, we're using it for different programs. So when I mention programs, I'm talking of categories of medicines. So we've categorized them as TB, malaria, HIV based on the types of diseases. So we're using it for all these programs. In total, we've got 7 programs, including the vaccine. So we've deployed it at over 1,400 entities. That's over the last 1 year. We started, that was in November 2020, marking it 1 year this time. On the left side of the slide, you see that's a screenshot of the mobile application that we're using. So it's got 3 modules: the inventory, orders, and the profile. The inventory, that's where we manage the different inventories, inventory actions that we do, like viewing stock, doing stock counts, or even entering discards. Whilst for the orders, that's where we manage the orders. So the system is being used to order medicines and vaccines from lower level to higher level facilities. Next slide, please. So I'll talk about the benefits of the system so far that we have here. It's given us real-time visibility of medicines and vaccines. That's at all levels, from last mile to central level. So when the medicines arrive or when the vaccines arrive in country, they are then transferred to the central warehouse where they are now orders that are being transferred, that are being processed from lower level facilities all the way to the last mile. We track medicines and vaccines by batch and expiry, which is a very big advantage. In Malawi, we didn't have a system that tracks medicine by batch and expiry. So using this one, it was a very big plus to us. And then we've got extensive dashboards and reports, just like Anup had actually mentioned. At the moment, we have deployed the dashboards at our Ministry of Health, that's our national headquarters, as well as at the vaccine warehouse. That's also the central level for the vaccine. And then we're able to manage the orders, like I've already mentioned, from last mile all the way up. We also have an ability to monitor the temperatures. We are yet to deploy these temperatures in the entities across the country, but at the moment, we've got them installed at the national warehouse, where we're able to monitor the temperatures remotely, and then we're also able to get alerts whenever there's a temperature shoot or whenever there's an incursion. Next slide, please. Okay, so just like any other system, when you deploy it, there always be challenges that you face. We've had challenges in Malawi. The first one being that we've trained 2 health workers at each entity. So this is at each SDP. So all these SDPs, most of them have got more than 2 health workers. And the health workers that have not been trained, they'll say, no, we can't use the system because we're not trained. And that's the challenge that we're having. We're having only the 2 people that were trained using. Of course, a few more guys, they're still willing to say, well, we will get trained on the job, and they are using the system. Another challenge is that the health workers are personalizing the mobile phones that they've been given. So those that came to the training, you'd find that somebody says, this is my mobile phone, despite clearly stating during the trainings that the mobile phones are for the facility or for the entity, not for personal use. But we still have 1 or 2 health workers that are personalizing the phones and preventing other health workers from using it. That's posing a challenge to us. And then the other one is that we've got some facilities that have got completely no network coverage. So in Malawi, we've got mainly 2 ISPs that are big. We've got Airtel and TNM. You'd find that some facilities, they don't have Airtel, they don't have TNM, and the users have to cover up to 12 kilometers to find network. So the advantage of the system is that it's got the offline capability, where health workers can be able to work offline, and then they can go to the place where there's network, and then the data will automatically upload to the cloud. And then another one is the change management, where you have some people that are maybe they forget to use the system, or maybe they're not willing to use the system. So we're continuously encouraging them that, hey guys, we need to use the system to attain this visibility that we're talking about. Next slide, please. Okay, so on my final slide, there is the benefits that we've had in regards to the COVID-19 vaccine. So just to mention, in Malawi, we have deployed this system during the COVID-19 period, where most of the businesses had shut down, most of the things had actually stopped moving. So we rolled it out during that period. And when the COVID-19 vaccine came in March this year, we actually gained some visibility that that was so important to the country. And we actually managed these 2 vaccines quite well. We've actually got 2 vaccines in the country. We've got the Janssen & Janssen, and then we've got the AstraZeneca. Using the system, because we're tracking it by product and by batch, we've actually managed to track and to increase the visibility of these two vaccines. And of course, also appreciating that they actually, some of them came with short life expiry. And though we had actually managed, though we had actually expired some of the medicines, but you would appreciate that we actually reduced the amounts of vaccines that actually expired, in the sense that there was a redistribution that could actually happen. For example, when we noticed that there is one facility that is running low on the vaccine, or maybe they're stocked out, and in the system, we're able to see that there's another facility within this vicinity, and they've got a lot of the vaccine, we could actually redistribute to make sure that we finish the vaccines before they expire. That's the last slide. I think we can take more questions at the end during the Q&A. Thank you.
Thank you, Joe. Thank you very much, Joe and Anup. We have some questions, so don't hesitate to ask more questions in the Q&A box or in the chat box. Let's start with the first one from Gary. Is the mobile app only used at the last mile, or is it also used in the warehouse? Maybe a question for Joe.
Okay, so we've got the mobile app. It's actually used at both the last mile and the warehouse. However, the health workers that actually work in the national warehouse, they are also the same managers that manage the program, that's viewing reports and also making redistribution decisions. So from the mobile app, we don't have reports. So they use both. They use the web for the reports, and when they go into the code room, that's when they'll use the mobile app. But otherwise, for the last mile, they only use the mobile app, not the web.
Okay, thank you. Hope it answers your question, Gary. Next question. How is the returns management in the system? Can Anup or Joe reply to that one? Should I repeat it?
Neeraj, do you want to reply to that?
Yeah, so there are a couple of ways where returns can be managed in the system. One is if you are using the system to do data entry once a day, where health workers are taking a supply of stock from the last point of delivery, going to a mobile unit for immunization and returning at the end of the day with some stock which is left over. The data entry can be done as a dispensing at the start of the day and the return of stock at the end of the day. That can be one way to model it. But really, it depends on what are the processes being followed in the supply chain. Between any service delivery point in the supply chain and any other service delivery point, may it be the district level warehouse to the primary health center or the primary health center to the health worker, dispensing and issues in any direction essentially any direction of stock can be recorded on the system and can be analyzed through our reporting framework.
There is a distinct returns feature on the app.
Okay, thank you. Thank you for this answer. Another question. Is the system tracking from main warehouse to field warehouse and then to beneficiaries?
It can be, but there is no warehouse management function in the software. We integrate with other WMS systems. And so, but the system does provide ample tracking between the facilities that you've described.
Great. Thank you. Next question. What are the various reports the system is able to generate? How had it increased the reporting rate?
I don't know how much the type and quality of the reports has increased the reporting rate. However, there are innumerable reports. It's a big data framework that can report on things in multiple dimensions, and we have some informational videos online about those things. But there are a lot. I think there's like more than 60 reports just out of the box. You can customize your own reports. If you can use Excel, you can customize your own reports and even set it on a schedule to auto create those reports using your Excel template, and then automatically messaging the various users in the system at the right time on the right day and so on. So there are innumerable reports and dashboards in the system, and they are customizable. Yes, the system is also monitoring monetary value if that value is configured in the system.
Thank you. So you replied to two of these
questions. Oh yeah, I replied to the next one. Yeah.
No problem. No, don't worry. The next question, how reverse logistics is taking place within the system?
Are we asking about how is reverse logistics happening in Malawi or in general?
Well, maybe we can take the example of Malawi and then in general, if they are not the same.
I think Anup, on that one you can answer in general because it's the same. It's the same way that it's done. I think you can be able to answer it better.
Sure. Well, we are handling reverse logistics across all the projects, and you can move. So that's the thing. This system is abstracted. It's actually the greatest benefit of this system is that it's very flexible. We've configured it like a graph composed of nodes and arcs, and so you can have facilities, and you can arrange those facilities in any supplier vendor customer types of relationships, so that you create hierarchies, and then you can confer upon each one of those nodes different functions. And so reverse is an interesting term here because it makes it sound like that you're going against the flow, but actually the way the system is developed, you can define flows in any direction, and the use cases should be supported. And so we do. So this system is used, for example, in collection systems in an agricultural space, not just in healthcare. So it does handle reverse logistics, and you can use it to collect waste if you want. You can use it to collect unused doses and open vials and so on. So it really depends specifically on the case, on what specific reverse logistics use case you're talking about. And by the way, how many items is the system able to manage? That's a good upper limit question. Neeraj, do you know the upper limit on that?
We don't really have an upper limit. Right now, the maximum materials that have been managed are in Malawi, which manages more than 2,500 materials on mobile as well as web. So health workers actually do data entry for 2,500 plus materials on their mobile phones, as well as wherever they are able to have laptops and computers on the computer. But there isn't essentially an upper limit for the line items or the number of materials that we can manage if there are, say, I don't know, 10,000 materials that somebody wants to manage, I'm sure we can manage our infrastructure in such a way that that can be possible.
Right, and that also reflects the fact that they've used different tools like menu search and pagination and many other considerations to make sure that it is scalable like that. I know it seems, how can, you might wonder, how can I manage 2,500 commodities using a mobile app? But actually, it's remarkably easy if you examine like how to use search, for example. You can, or autocomplete. You can autocomplete your search term and so on. And these things all help in terms of managing several commodities rather than having to scroll through a very long list. That doesn't happen.
Right. One more question on how many line items are we able to manage? As I said, there isn't really a limit. But as an example, I would like to mention that on one of our past projects, we were managing as many as 60 million transaction items per year, which was a bigger project. So essentially, I'm just as an example, 60 million sounds a lot, but for bigger countries, that might not be even an upper limit, and it might go even higher.
Thank you very much. So if you have more questions, don't hesitate to write them in the chat box or in the Q&A box. I have some questions that were also asked during the registration process. I think you replied partially or perhaps completely to some of them, so just let me know. Is the system tracking from main warehouse, sorry, is the system tracking from the main warehouse to field warehouse and then to beneficiaries?
I guess that's coming to me.
Yes.
Okay, yeah. So it is tracking from the main warehouse through to the regional, to the district, and then to the last mile. So it's going all the way to the client, to the point where the SDP, the health worker, has actually given the vaccine or the medicines to the client or the patient.
Okay. And is the mobile app only used at the last mile, or is it also used in the warehouses?
It is used at both the last mile and the warehouse and the national warehouse.
Great. Is this tool readily available to individuals or organizations? Will it need special training? I think you answered somehow, but please, if you have more to say about it.
I actually think it's a very intuitive app. You can kind of stumble through it and figure out exactly how it works. But for first-time users of technology and folks that are not as experienced in using mobile apps and touch screens and so on, yeah, I think that a little bit of training is very helpful. And once again, it all depends on how complex your use case is. Like, what is the SOP? And the more complicated it is, the more time it takes to train. And I also understand that we're in an environment in global health where there is extensive training on things, as opposed to some of our other use cases where training is very brief, and folks kind of get the hang of it in like an hour in other verticals. So yeah, it's variable.
I would just like to add to that what Anup said, is that we do follow, like I think most other solutions, a training of trainers model, where we do train our partners in country and then subsequent trainings happen in country. But during the COVID pandemic, we had one instance where last mile trainings for last mile users happened via Skype or via Zoom. And I think that is just an anecdotal evidence on on how intuitive the apps can be, and with the advent of technology, things are actually readily understood by users. So sometimes, not always, a lot of training might be required, and it can vary regionally or locally.
Okay.
Also, maybe just add on that, on the
Yes.
training, on the training structure for Malawi. We had the Logistimo team that trained our IT side. And then from UNDP IT, we did train a pool of TOTs. These are more than 20 people that eventually carried out the main training, the rollout training. That's to the 1,600 plus people in groups of 30. So because it was done during the COVID pandemic, we had to do it in groups of 30s to the point we reached that 1,600 figure. And that was actually trained during this second half of 2021.
Thank you. Another question from Gary. Is there any warehouse management in Logistimo?
No, we don't have a warehouse management function that handles staging, put away, pick lists, and outbound staging. We integrate with other WMS systems.
Thank you, Anup. Next question. Can the system be integrated with private pharmacy?
Yes.
Okay.
It has been in the past.
Okay, good. Next question. Can you discuss the forecasting model? What variables are used for calculation? Do you account for back orders?
So yes, and there are multiple forecasting methods. It's not like there's just one forecasting method. There are a lot of ways for you to customize it. You can define how many periods to look back if that's the model. You can define how it's calculated. And you can also put in a manual forecast as well. It doesn't have to be only calculated. And it's very customizable. This is the thing about Logistimo, is because of the abstraction we spoke about before, you can actually, and the system supports having a multiplicity of different inventory policies running in your system as you need when you have different verticals. Vaccine replenishment may not look like family planning replenishment calculus. So it's very customizable. The forecasting can be done in so many different ways. And so we will support, so your typical min-max, is a typical thing, min-max, or you can change that to a VMI, a vendor managed inventory type of system that is based on some other calculus. So it's the forecasting part is very customizable, and it has to be in order to support a multiplicity of different commodity codes.
Thank you. The next question, what about interoperability with other solutions used at central level?
At the central level or any level, interoperability is a question of integration. And we provide APIs, and those APIs, to accompany them, we help define an integration case so that the data elements can be mapped and modeled in both systems and equated. And then we also provide test keys in a test environment. We access keys in a test environment. So we support interoperability that way. We've done integrations. There's an integration going on right now with DHIS2. We've done various ERP integrations. We've done lots of RTM integrations. We have an integration with immunization registry, our own registry system, and we have an integration with the fleet management system, so transportation management systems as well. So it's just like the answer for most web systems, I think, that it's definitely possible, but there is a little effort to do it.
Thank you, Anup. Next question from Bosco. Can the system support the cash to customers, C2C, and produce to pay P2P modules?
I don't know. I don't know enough about cash to customer and the P2P modules to answer the question. Yeah, sorry.
That's all right. Thank you. I have some other questions. How do you manage demand supplies and uncertainties? How do you manage demand supplies uncertainties?
How to manage supply uncertainty?
Yeah, how do you manage demand and supplies uncertainties?
Well, I mean, typically you hold inventory, right? I mean, that's what a supply chain folks will do. They'll say we'll hold inventory when we don't know. And that's one way of managing that uncertainty. And then there are other ways of managing uncertainty, like forward positioning stocks in various places where you think it can be used, along that, what they call the push-pull barrier. But if there's any other kind of uncertainty management, it's through the information system, where because of the more real-time visibility, because of the provocative way of disseminating that information so that it creates sort of social interactions and that nudging for users to make better management decisions. I think that we also reduce that uncertainty of what else is going on in your supply channel, so that you can work more in concert with your suppliers and your customers downstream. So through information systems, we reduce those information delays, and that reduces what they call the bullwhip effect. And then just uncertainty of supplies, which I think we're all experiencing now these days. Holding inventory is one way to do that.
I would like to also add in by saying that uncertainties can also be handled by improving efficiency. And that can be done by a couple of ways. One is we have a stock redistribution module and rebalancing module, as we call it. And what that can enable is to move stock horizontally across stores in the same neighborhood, for example, where one store might have excess stock, and that can help another store close by which might be running out of stock. And there are algorithms which can facilitate this sort of rebalancing across stores in a certain geographical region. So that is one thing. And the other thing, as Anup said, is essentially to reduce discards at various stores by sending nudges to use supply that might be expiring sooner, using a first expiry, first out model, and sending notifications around this sort of a model, so that there is more efficiency in the system, and such uncertainties can also be handled by that.
Thank you, Niraj. Great. Next question. Does your system help in identifying expiring medicines or drugs?
Yeah, of course it does. That batch level visibility that we were talking about earlier, usually those batches or lot numbers have an expiration date. And we have on search menus, you can say in the case of a recall, for example, you'll be able to search for batch numbers, and it will show you at which facilities throughout your network do those batch numbers exist. So that similarly, you have expiry management, where you can set a date, and you can ask the system, give me all the inventory items that are going to expire by this date, and then the system will give you that list. And further, it will give you access to the contact information to the people managing in those places, so you can communicate with them if there's a threat of expiry. In the main dashboard, when you log in, if you have predictive analytics turned on, it will give you there's a little widget at the top, and it says this many numbers of items are set to expire before this date, and it gives you an action button that helps you do something about it, either to move it laterally in the same echelon, or to move it downstream to otherwise prevent that expiration event from happening.
Thank you, Anup. Next question. Is the software offline mode? Can you share more details on how it works? If it works offline.
Yes, the system works offline. I think Joseph was talking about that earlier, where there's no network connectivity. Folks are still able to collect information and refer to the information on the app. And so the way the offline works is this. When you're offline, obviously it can't transmit information back up to the cloud, but you don't have to be consciously looking for the network signal, and you don't have to press the button to send it. The system will when the mobile device enters an area with signal, whatever the kind of signal, it can transmit the data back. It can relay the data back to the cloud, and the user doesn't have to worry about it. It will happen. And so, and if you do have information that's on the device that hasn't been transmitted yet, you will see that it's flagged, like it'll be a red flag saying, this is data, new information that you've collected, but it hasn't gone to the cloud yet. And so the user is aware when that information has yet to relay back. And then they'll know when, by the absence of those red flags, that the information has passed back up to the cloud.
Thank you, Anna. There's a question. There's a question about sustainability of the software. What if funds are not available to pay for yearly subscriptions?
So we have the base model for us is the monthly pay as you go. So basically, if you can take it in monthly slices, where post facto, in other words, after you use the system for a month, we calculate and bill the customer for what was consumed, what was used. That's one method. And then the other method is, if you do have the resources, then an annual reservation, which is essentially a prepayment of what you expect to use throughout the year, is available. And that comes at a 40% discount, because that certainty is worth quite a lot to not just to us, but also along our cost base, which is the cloud providers, like Amazon Web Services or Google Cloud or Microsoft Azure. They give the same discounts to us if we make annual reservations. So we extend the same 40% over to the customers as well.
Excellent. Thank you, Anna. There's another question that just popped in. How has the system helped in improving data quality at the last mile in Malawi for better information decision? So that's a question for Joe. Joe, should I repeat? Let me repeat it. How has the system helped in improving data quality at the last mile in Malawi for better informed decision?
All right. Okay. So I'll speak on two sides. Looking at the EPI side, that's the vaccine side. There was no electronic system that was moving data from the last mile to the district level. So there was all paper from that level. So the data quality was not good, in the sense that when we're looking at manual forms, there can be spellings that somebody's failing to read, or there can be issues that of data quality, in the sense that there was no validation of the information that's on the paper report. So having this information via eHIN has actually improved the data quality, in the sense that the information is readily available, and it's information that you can actually validate with what's on the ground or what was in the system previously. The system is also able to give us information where the stock balance is actually mismatched. So when you're updating when you're doing the stock count, there is an option that you can be able to see who changed what stock from which level, from which figure to which figure. So with that tracking of information, we're able to see that, okay, the information the quality has improved. Now, from district level to the national level, there's been a system that is Excel based, moving the information from between these two levels. The information, the quality also on that has actually improved, in the sense that, like I've mentioned before, there is actually a validation that we're able to do with the eHIN system, unlike what was available on the Excel, because the reports between the 2 months could be different. Whilst on this one, we've got a track record. Going to the pharmaceutical side, the information has the data quality. I wouldn't say the data quality has improved because we already have another system that's also moving those data from the last mile, not from the last mile, but from the pharmacy to the national level. So there's already open LMIS that was operating on that space, and so it's an issue that we have actually moved the information from the last mile to the central level MOH department. That's the part that we've actually automated. Digitalized from the last mile to the pharmacy. That part was not there. I don't know if that answers your question.
Well, Oshunu, if you have more questions, you can elaborate. You can ask for more elaboration. Thank you very much.
Yeah, thank you.
We don't have that many questions left. Actually, we have one question left. So if you have more questions, don't hesitate. It's we still have a little bit of time to answer them. Someone is asking if you can have access to the presentation and the recording. Yes, we will share the presentation and the recording by email to everybody who registered. It's also going to be available on the TechNet website. And we'll share also the information in the Telegram group. I shared the link of this Telegram group in the chat box. Last question, but I think Anup, you mentioned that. Are there any other country that is using your eLMIS system? Perhaps you can repeat that. Anup? Have we lost Anup?
Anup, you're on mute.
Sorry,
Yeah,
I was talking on mute.
Okay.
Yes, I can share that in addition to Malawi, which is using the system in a very robust way across verticals, we have countries that are just using it for their EPI program as well. That includes the Ministry of Health in Senegal, the Ministry of Health in Angola, and the MOH in Zambia. And in all those countries, I think they're using the system for vaccines, but also for some COVID related commodities, be it vaccines or other COVID related commodities. So those are the EPI programs in Africa. And of course, we've had experience in South Asia, Southeast Asia, and other countries in Africa where, for example, South Sudan, the system in 2012, was implemented in South Sudan. Unfortunately, that project did not persist due to the situation on the ground at that time. But right now, just the 4 EPI programs in Africa that I mentioned: Senegal, Angola, Zambia, and Malawi.
Thank you, Anup. There's no more questions, so this is your last chance if you want to ask anything else. Nope, there seems to be fine. Okay, I think we've answered all the questions. That was great. Thank you very much. I would like to thank our panelists for their time and engagement. As a reminder, again, as I said just before, we'll send you the links and to the recording and the slides by email. They will also be made available on the TechNet 21 website. And if you can also already register to our next session next week with the Medexis. I'm going to share the link now in the chat box so that you can register now. Voila. Thanks again, and we hope to see you next week with Medexis. Thank you very much, guys, and I wish you a nice evening, and Anup a nice day. I know it's very, very early for you in Seattle. Bye-bye. Have a nice day, everyone. Thank you.
Thank you. Bye.
Thank you.
Bye-bye.
Bye. Thank you. Bye.